Most people assume the danger ends once a swimmer gets out of the water. A child coughs after swallowing pool water. An adult clears their throat after a wave crashes over them. Everyone dries off, packs up their belongings, and continues with the day. In most cases, nothing serious happens. However, water-related breathing complications can sometimes develop after the swimming has ended, and recognizing the warning signs can be critical. The term dry drowning is commonly used to describe breathing difficulties that occur after a water incident. While medical professionals may use more specific terms to describe these conditions, the underlying concern remains the same. Water entering or irritating the airways can sometimes trigger breathing problems that do not appear immediately. Instead, symptoms may develop gradually over the hours that follow, making them easy to overlook. When water is inhaled, even in small amounts, it can irritate the lungs and airways. This irritation may lead to inflammation, swelling, or difficulty exchanging oxygen efficiently. As oxygen levels begin to drop, the body often produces warning signs that signal something is wrong. The challenge is that these symptoms may seem mild at first and can easily be mistaken for simple fatigue or cold or after effects of a long day in the sun. Understanding these signs is not about creating fear. It is about knowing when the body may be struggling after a water-related incident and recognizing when medical attention may be needed. In this video, we'll explore 10 warning signs that should never be ignored, explain what may be happening inside the body, and discuss why early recognition can make all the difference. Number 1, persistent coughing that doesn't go away. The first warning sign often appears deceptively harmless. In fact, it is so common that many people dismiss it entirely. A cough after swallowing water seems normal. Most swimmers have experienced it. A mouthful of pool water during a dive, a wave crashing unexpectedly into the face, or a brief choking episode can trigger a temporary coughing fit. In most situations, the cough disappears quickly because the body's protective reflexes have done their job. The concern begins when the cough refuses to go away. Persistent coughing after a water incident may indicate ongoing irritation within the respiratory system. The lungs and airways are lined with sensitive tissues designed to keep foreign substances out. When water enters areas it shouldn't, these tissues can become inflamed. Even small amounts of water may trigger irritation that continues long after the swimmer exits the pool or lake. The body responds by activating one of its most powerful defense mechanisms, coughing. This reflex attempts to clear the airways and protects oxygen flow. However, if irritation continues, the cough may become repetitive, frequent, and difficult to suppress. What makes this symptom particularly important is that it serves as an early clue that the respiratory system is under stress. The lungs are responsible for delivering oxygen into the bloodstream while removing carbon dioxide. Any disruption to this process forces the body to work harder. Parents often assume a child who is coughing hours later simply has allergies or a mild cold. Adults may blame throat irritation, yet context matters. If persistent coughing develops after a near-drowning event or significant water aspiration, it deserves attention. Number 2, unusual shortness of breath. Breathing is something most people never think about. It happens automatically, quietly, thousands of times each day. Because of this, changes in breathing often go unnoticed until the problem becomes significant. Shortness of breath following water exposure is one of the most important warning signs to recognize. It may begin subtly. Tiny air sacs called alveoli are responsible for oxygen exchange. These microscopic structures transfer oxygen into the bloodstream and remove carbon dioxide. When water reaches the lungs or causes inflammation, these delicate sacs may become less efficient. Imagine trying to breathe through a sponge instead of an open airway. Oxygen movement becomes more difficult. The body responds by increasing breathing effort. Initially, this may look like faster breathing. Later, it can progress to visible respiratory distress. The chest may rise and fall more dramatically. The individual may complain that they cannot get a full breath. What makes this symptom especially dangerous is that oxygen levels can decline before obvious signs appear. The body is remarkably good at compensating. Heart rate increases, breathing rate rises, muscles work harder. For a while, these adjustments create the illusion that everything is normal. Eventually, however, compensation reaches its limit. This is why shortness of breath should never be dismissed after a water incident. It may indicate that the lungs are struggling to perform one of the most essential functions for human survival. And when oxygen delivery begins to suffer, other warning signs often follow. Number 3, extreme fatigue or sudden exhaustion. One of the most overlooked signs of respiratory compromise is exhaustion. People naturally feel tired after swimming. Water activities are physically demanding. Hours spent in the sun can leave anyone feeling drained. But there's a significant difference between normal fatigue and the kind of exhaustion that signals a medical problem. When the lungs are unable to efficiently deliver oxygen, every organ in the body feels the consequences. Oxygen serves as the fuel that powers cellular activity. Without enough of it, tissues struggle to generate energy. The result is profound fatigue. A child who was energetic all day suddenly wants to sleep immediately after getting home. An adult feels unusually weak. Simple activities become surprisingly difficult. The body enters a state of energy conservation. From an evolutionary perspective, this response makes sense. When oxygen becomes limited, the body prioritizes essential functions. Non-essential activity is reduced. Movement slows, alertness decreases. Unfortunately, this protective mechanism can also mask a developing emergency. Parents may assume a child is simply tired from swimming. Friends may encourage someone to take a nap. But abnormal sleepiness following a water incident deserves careful observation. Sleep itself is not dangerous. The concern is what the fatigue may represent. If oxygen delivery is compromised, sleeping can make it harder to recognize worsening symptoms. The key question becomes whether the level of tiredness matches the circumstances. If exhaustion appears disproportionate to the activity performed, especially when accompanied by coughing or breathing difficulties, it may be the body's way of signaling that oxygen supply is falling behind demand. And when oxygen begins affecting the brain, the next warning sign can emerge. Number 4, changes in behavior or mental confusion. The human brain represents only a small percentage of body weight, yet it consumes an enormous amount of oxygen. This dependency makes the brain one of the first organs affected when oxygen levels begin to decline. Behavioral changes after water exposure can therefore serve as an important warning sign that something more serious may be occurring. In children, this might appear as irritability, unusual clinginess, emotional outbursts, or difficulty concentrating. Parents sometimes describe the child as simply not acting like themselves. In adults, symptoms may include confusion, poor decision-making, forgetfulness, slow thinking, or an unusual sense of mental fog. These changes occur because brain cells are highly sensitive to oxygen fluctuations. Even modest reductions in oxygen availability can influence cognition, mood, and awareness. What makes this symptom particularly challenging is that behavioral challenges are easy to misinterpret. Fatigue, stress, dehydration, and excitement can produce similar effects. Yet, when mental changes appear after a significant water incident, they should not be ignored. The brain acts almost like an oxygen monitor. Its performance reflects the quality of oxygen delivery occurring throughout the body. Healthcare professionals often pay close attention to mental status because it provides valuable clues about physiological stability. A person may not recognize their own confusion. Family members are often the first to notice that something feels off. Trusting those observations can be critical. When behavior changes combined with respiratory symptoms, the body may be signaling a deeper issue that requires prompt evaluation. Number 5, rapid breathing. One of the clearest signs that the body is working harder than normal is an increased breathing rate. Unlike coughing, which may come and go, rapid breathing often reflects an active physiological struggle occurring in real time. The body constantly monitors oxygen and carbon dioxide levels through specialized sensors. When oxygen begins to fall or breathing efficiency decreases, these sensors trigger an immediate response. Breathe faster. This response is designed to increase oxygen intake and maintain balance. Following a water aspiration event, inflammation or irritation within the lungs may reduce gas exchange efficiently. The brain responds by instructing the respiratory muscles to work harder. At first, the increase may be subtle. Over time, however, breathing can become noticeably rapid even without physical activity. This symptom deserves attention because it often represents the body's attempt to compensate before a more severe crisis develops. The respiratory system is fighting to maintain oxygen levels. Imagine a factory losing productivity. Rather than fixing the underlying issue immediately, management increases the speed of every worker. Production temporarily continues, but the strain grows. The same principle applies here. Rapid breathing is not the problem itself. It is evidence that the body is trying to overcome a problem. Observers may notice flaring nostrils, chest retractions, visible effort, or an inability to speak comfortably without pausing for breath. These signs indicate increasing respiratory workload and should never be ignored. Because when breathing becomes harder and oxygen becomes scarcer, the body's warning signals become even more dramatic. Number 6, chest pain or tightness after water exposure. As the body continues struggling to maintain normal breathing, one of the more alarming yet often underestimated warning signs can emerge: chest discomfort. This is not the sharp, dramatic pain often associated with sudden injury, but rather a tightening, heaviness, or pressure that gradually becomes noticeable after a water incident. To understand why this happens, it is important to look at the mechanics of the lungs under stress. When water irritates the airway lining or reaches deeper into the respiratory system, the body responds with inflammation. This inflammation response causes swelling in the delicate tissues responsible for oxygen exchange. As the airways narrow and the lungs become less flexible, every breath requires more effort. This increased workload creates a sensation of tightness. The muscles surrounding the rib cage and diaphragm begin working harder to compensate for reduced lung efficiency. Over time, this muscular strain can manifest as chest discomfort. What makes this symptom particularly concerning is its association with reduced oxygen intake. When breathing becomes less effective, the heart must also work harder to circulate oxygenated blood. This combined strain on both respiratory and cardiovascular systems can create a feeling of pressure or heaviness in the chest. In real-world situations, this symptom is often dismissed. Swimmers may assume they are simply sore from activity. Parents might think a child is experiencing anxiety after a scary moment in the water. Adults may attribute it to fatigue or dehydration. However, when chest tightness appears after a known water aspiration event, context becomes critical. The chest is essentially the intersection point of two vital systems, breathing and circulation. When either system becomes compromised, the body often signals distress through this region. Even mild discomfort should be taken seriously if it develops alongside coughing, fatigue, or changes in breathing patterns. Number 7, persistent wheezing or noisy breathing. One of the most recognizable signs of airway obstruction or inflammation is wheezing. This high-pitched whistling sound occurs when air is forced through narrowed or partially blocked airways. After a water-related incident, wheezing can develop as a direct result of irritation in the bronchial tubes. When these airways become inflamed, their internal diameter decreases, restricting airflow. As air moves through these tightened passages, it creates vibration in the surrounding tissues, producing the characteristic sound. Unlike a simple cough, wheezing often indicates a more structural issue within the respiratory system. It suggests that airflow is not just irritated but physically restricted. In mild cases, wheezing may only be noticeable during exhalation or physical activity. In more concerning situations, it can occur even while resting, signaling that the airways are significantly compromised. The body interprets this restriction as a threat. In response, it may increase respiratory effort, leading to a cycle of faster, more forceful breathing that further irritates the airways. This creates a feedback loop in which inflammation leads to restricted airflow, and restricted airflow leads to more strain. From a physiological perspective, wheezing represents a critical turning point. It indicates that the smooth flow of air through the lungs is no longer uninterrupted. Instead, air is being forced through narrowed pathways, requiring additional energy and effort. In everyday life, this symptom is sometimes mistaken for mild asthma, seasonal allergies, or even anxiety. However, when wheezing appears after a water incident, it should be viewed through a different lens. It is not simply a sound, it is evidence of mechanical resistance within the respiratory system. Number 8, bluish lips or fingertips, cyanosis. One of the most visible, alarming warning signs of oxygen deprivation is a bluish tint in the lips, fingernails, or fingertips, known medically as cyanosis. This symptom indicates that oxygen levels in the blood are dropping below normal thresholds. The human body relies on oxygen-rich blood to maintain its characteristic healthy color. When oxygen levels decrease, blood becomes darker, and this change can become visible in areas where circulation is close to the skin surface. After a respiratory stress event related to water exposure, cyanosis suggests that the lungs are no longer efficiently oxygenating the blood. This is not a subtle symptom and should always be treated as a serious warning. What makes cyanosis particularly important is that it reflects a systemic issue rather than a localized one. By the time discoloration appears in the lips or fingertips, oxygen delivery has already been significantly compromised throughout the body. The brain, heart, and other vital organs are highly sensitive to oxygen levels. Cyanosis indicates that these systems may already be under strain. In practical terms, this symptom may begin subtly. The lips may appear slightly pale or faintly blue in certain lighting. Fingertips may look unusually cool or discolored. As oxygen deprivation worsens, the color change becomes more pronounced. Unlike earlier symptoms such as coughing or fatigue, cyanosis is a visible sign that does not rely on subjective interpretation. It is a direct reflection of oxygen saturation in the blood. In any post-water incident scenario, the appearance of bluish coloration should be treated as an urgent medical concern. It signals that the body's compensatory mechanisms are no longer sufficient to maintain normal oxygen levels. Number 9, vomiting or nausea after swimming. Although often overlooked, gastrointestinal symptoms can also appear following water aspiration events. Nausea or vomiting may develop as the body reacts to stress, irritation, or changes in oxygen levels. When water enters the respiratory system, it can trigger a reflective response involving both the lungs and the digestive system. The vagus nerve, which connects the brain to several internal organs, plays a key role in this interaction. When irritated, it can contribute to sensations of nausea or even vomiting. In addition, reduced oxygen levels can affect the body's overall equilibrium. The brain and inner ear, both responsible for balance and orientation, are highly sensitive to oxygen fluctuations. When these symptoms are disrupted, nausea may follow. In children, vomiting after swimming is sometimes dismissed as a reaction to swallowed pool water or motion sickness. However, when combined with coughing, fatigue, or breathing changes, it may indicate a deeper physiological response. From a clinical perspective, vomiting in this context is not a primary symptom of airway compromise, but rather a secondary effect of systemic stress. It reflects the body's interconnected response to oxygen imbalance and internal irritation. The presence of nausea or vomiting alone is not necessarily dangerous. However, when it occurs alongside respiratory symptoms after water exposure, it becomes a meaningful piece of the overall picture. Number 10, delayed deterioration over several hours. Perhaps the most important and least understood warning sign is not a single symptom but a pattern: delayed worsening. One of the defining characteristics of post-water respiratory complications is that symptoms may not appear immediately. A person can seem completely normal after leaving the water, only to develop signs of distress hours later. This delay occurs because inflammation within the lungs can progress gradually. Initially, the body may compensate effectively, masking the early effects of irritation or minor fluid aspiration. However, as swelling increases and oxygen exchange becomes less efficient, symptoms begin to emerge. This is why observation over time is critical. A swimmer who appears fine at first may later develop coughing, fatigue, behavioral changes, or difficulty breathing. The progression can be subtle at first, then accelerate as the lungs become increasingly strained. Delayed deterioration is particularly important because it separates minor water exposure from a potentially serious medical event. It is not the immediate reaction that determines risk, but the body's response over time. In many documented cases, the most concerning symptoms appear within a window of several hours after the incident. This is why medical guidance often emphasizes monitoring after significant water aspiration, even if the person initially appears stable. The concept, often referred to as dry drowning, is widely misunderstood, but the underlying concern it represents is very real. The possibility of delayed respiratory distress after water exposure. What makes this topic so important is not its rarity, but its unpredictability. A seemingly harmless moment in the water can sometimes lead to delayed inflammation, airway irritation, or reduced oxygen exchange that only becomes apparent hours later. Across all 10 warning signs, the body consistently communicates distress through interconnected systems, breathing, circulation, brain function, and energy regulation. Each system alone may not indicate a severe problem. However, context is everything. When multiple signs appear after a water incident, they should never be dismissed. The human body is remarkably resilient, but is also highly sensitive to oxygen balance. Even small disruptions in the respiratory system can ripple outward, affecting energy, cognition, and overall stability. This is why awareness matters, not to create fear, but to create understanding. Water activities are meant to be safe, enjoyable, and life-enhancing. Recognizing warning signs ensures that enjoyment is not interrupted by preventable complications. In the end, the most powerful tool is attention, listening to the body, observing changes, and understanding what they may represent can make the difference between reassurance and risk. Because sometimes the most important warning signs are not loud or immediate. They are subtle, delayed, and easy to overlook until you know what to look for.